This is Dr. Fox. Thank you all for your continued support for CRPN and CRPN Central. For more information about our mission, please contact us today at info@crpainnet.com for details.
I have your results, and I'm sorry to say it is breast cancer, and it's advanced. We have some options, but none are 100%.
I was afraid you were going to tell me that. What am I going to do? What about my family? My children are so young. How will I afford to pay for this without being able to go to work during my treatments? I'm scared, doctor. What options do I have?
Well, standard of care would still give you a 50% chance of reoccurrence, and depending on the tumor's responsiveness, it may not work at all. There is an option to participate in a clinical trial. So far, the results are promising, and I believe you would qualify. However, it's too early to predict any results.
So a 50% chance it will work with a 50% chance it will come back. Or take a chance and not know the outcome. Well, if I participate in a clinical trial, I could help others who are going through this. Let's do this. I'd like to be part of the trial.
Okay. I'll connect you with my colleague who's running the trial. Her team will contact you, pre-qualify you, explain the study in detail, and hopefully get you started. Don't give up. You're in good hands.
6 months later.
Well, it has been a very rough few months. I really hope it was worth it. Doctor, do you have the results from my clinical trial treatments?
Thank you so much for coming in on short notice. I know these past few months have been quite a roller coaster, but your labs and scans came in this morning, and I wanted to deliver the good news in person. The therapy did exactly what we were hoping for, and you are in full remission.
You mean it's completely gone? It actually worked? Oh my. Thank you, doctor. You have no idea what this means. Oh, thank you so much. And thank you to everyone on your team who took care of me during this difficult time. This is fantastic news.
You did all the hard work. I'm just glad we had a clinical trial that could help right when you needed it. There will still be some follow-up monitoring and visits, so please don't delete the clinic number just yet. But the whole team is so happy for you and so excited to see what you do next.
Breast cancer, a detrimental diagnosis given to so many in our world, and one that takes so many lives in our society. The patients who received this diagnosis today have so many new innovative treatment options now than they had compared to those who went through the journey 2, 5, and even 10 years ago. And we will continue to improve care for our patients as long as we do not give up. Sites and sponsors. Breast cancer continues to take lives as we speak. And although we have come a long way in its treatment, we still have a long way to go. We must work together to truly enhance clinical research, focus on the lives we save, and remember why we are here. Breast cancer patients, I know your world was turned upside down with this diagnosis, and it's okay to be scared. Please, know you are not alone in this journey. Lean on your community, and know you have an entire industry working to help you. On behalf of the Clinical Research Payment Network, welcome to Breast Cancer Awareness Month. Welcome to CRPN Central, the official podcast of the Clinical Research Payment Network. I'm your host, Dr. Daniel Fox. CRPN Central discusses the real issues with our clinical research industry to explore and identify mutually beneficial solutions for all of our stakeholders. Breast cancer continues to bring pain, hardship, suffering, and sometimes even death for millions of women and men. In a world where we have advanced tremendously as a society to care for breast cancer patients, there is still a long way to go for clinical trials to deliver optimal care to those in need. How can we improve the experiences and outcomes of our breast cancer patients in health and clinical research communities? October is Breast Cancer Awareness Month, and in observance, we will discuss breast cancer awareness and prevention in our community. The American Cancer Society predicts that in 2023, almost 300,000 women in the U.S. will receive a breast cancer diagnosis, making it the most common cancer in American women. What's more, Almost 44,000 patients are estimated to die from breast cancer this year. First, we will speak with a breast cancer survivor who will share her journey through her diagnosis. Then, we will talk with a team of innovators who are dedicated to breast cancer detection and advanced stage prevention. To maintain valid comparisons, both interviews will use the same questions, and my guests did not know the questions before the interview. We will reconvene after the interview to compare opinions, identify alignments, and perhaps explore possibilities to improve the care of our breast cancer patients for generations to come. Our first guest is a loving wife, stay-at-home mother, and cancer survivor who has just recently spent the past 2 years of her life on a long journey. Courtney Hine received her cancer diagnosis at 33 years of age. She endured multiple surgeries, chemotherapies, and radiation treatments, and through strength and community support, survived. I am so thankful Courtney has taken the time to be with us today, and I appreciate her willingness to share her story. Please welcome with me Miss Courtney Hyde. Thanks so much for coming on to CRPN Central today.
Thank you. Thank you for having me.
Oh, it's a pleasure. Courtney, would you be willing to introduce yourself to the audience?
Sure. My name's Courtney Hine. I am a stay-at-home mom. I have 2 daughters. They're 7 and 5. I've been married for 13 years now. We live in Pennsylvania. And ever since I had my first daughter, I've been a stay-at-home mom. Before that, I worked at Target as a manager for a little while. I worked at online college. Really, my main focus is my kids right now.
My wife stays at home. For anyone out there who thinks that stay-at-home moms don't have anything to do, they're crazy.
Yes.
It is literally a full-time job.
Yes.
I don't know what I would do without my wife. She stays at home. She kind of keeps me in check. She does everything to help me focus on what I'm doing. Huge respect to our stay-at-home moms there in the world.
Yes. My husband always says, I couldn't do what you do.
Yep, pretty much. I've said that before too. Courtney, this episode is dedicated to breast cancer and breast cancer awareness. Do you have experience with breast cancer?
Yes, I was diagnosed with breast cancer in February of 2021 at age 33.
I'm so very thankful that you're willing to have this conversation with me today. Breast cancer is very important to me as well. And working in the healthcare field, I have seen many lives lost to breast cancer. And raising awareness to this and what we can do to help is critical to try to help our society and so many women and men out there who are going through this journey right now. I'm going to ask you a series of questions. They're exploratory questions about breast cancer. And I've already asked these questions to another individual. When we're done, we're going to come back and we're going to compare the answers to try to understand any similarities or alignments in breast cancer awareness in the industry, and maybe how we can make things better in our society.
Okay, sounds good.
Could you describe your journey through breast cancer from start to finish?
How much time do we have? It's a long story. The way that I found my breast cancer was I started having some pain in my left breast, which is not normally how it's found. So I wasn't initially alarmed. I went to see my doctor and she said, let's just do a mammogram just to be sure. Went in for the mammogram. Again, was not expecting, you think about it, but I wasn't really expecting to find anything. And pretty much right when I had the mammogram and the doctor came in at the end, he basically told me there, even though I hadn't had a biopsy or anything, he said, based on what we see, you most likely have it. Basically, you do have it. So I was shocked. Again, I was 33, so I was very young. I don't have a history in my family of breast cancer, was not on the lookout for it. From there, I went through a series of testing to see how big it was, if it had spread anywhere else. And those initial 2 weeks of testing was just mental torture of just feeling like you don't know. You don't know how bad it is. You don't know if it's spread. You don't know what your prognosis is. You haven't met with the doctors. I was looking for who to go with, what doctor to move forward with, what organization. Along the way, like nothing's easy. So in the beginning, they did testing to see if it had spread and they found a tumor in my adrenal gland. It's a long story, but it's okay in the end. It was, is that breast cancer? And I had to do additional imaging biopsy and they were able to determine it was not breast cancer. So the breast cancer was contained, but we didn't know if it was a separate cancer that had just been located. did. The thing with adrenal cancer is you don't know if it's cancer until they take out the adrenal gland. So you do some other testing to see if there's hormone production. Mine was producing hormones, so it had to come out. So we thought there was a really good chance that it could be cancer. And for 2 months, I didn't really know what my prognosis was. And I think that was the hardest thing. And in the end, it came out and it was not cancerous. It was just a hormone secreting tumor. So all was well there. But in the meantime, I had started chemo, had to stop it to have the surgery because they didn't initially think it was going to need to come out. And then it did. Then I had to recover from surgery. And then I had to keep doing chemo. That was very unexpected. And I think when you talk to people, a lot of times you find that there are a lot of unexpected things along the way, or it just never feels straightforward. So for me, that was not the norm, but that was part of my journey. I went through 12 weeks of one type of chemo, and then I went through 4 biweekly treatments of another type of chemo for my specific breast cancer, which was determined in the beginning, finally, to be stage 2 invasive ductal carcinoma. My prognosis was good. Once we figured out the adrenal tumor was not cancerous. I handled the initial chemo well, and then it got harder and harder when I started the second chemo. That really hit hard. I actually had to have them switched. A lot of times people do the one first and the other second, but for various reasons, I had to do it the opposite order. I lost all my hair. So of course, that's always the emotional piece there. But I will say for me, by that point, it was almost just like, whatever. There are so many other things that were hard. That was hard, but it was not the hardest. And then I made it through my chemo. I had a mastectomy on my left side. Again, nothing was easy. They thought it wasn't in my lymph nodes. Further testing after the mastectomy showed that there was a lymph node that had some cancer in it. So I had to go back in for a second surgery and have more lymph nodes taken out, which were all clear. So that was good. It was just another thing that was not the norm usually. A lot of times you have your mastectomy first and then chemo, but the area of my cancer was so large that they did the chemo first to try to shrink it and get better margins, which they were able to get, especially after the doctor went back in. And then I had to have radiation. So after I recovered, I did the whole thing. I did everything, every piece of it. 5 weeks of radiation every day. So 25 sessions through the holidays, 2021 into 2022. So that made it a little tougher. And then I came out of that. I had to recover for a while until I could have reconstruction surgery, not until the following fall. I finished radiation in January of 2022. And I had my reconstruction surgery in September of 2022. And then I had second reconstruction to do additional work in December of 2022. By the time I was done recovering from that, it had been almost 2 years of treatment followed by surgeries and so on. And since then I have 5 years of hormone therapy that I'm on. So I just hit 2 years. I go once a month to the cancer center to get a shot. That puts me in medical menopause, basically, to suppress hormones. And I take a pill that suppresses hormones since my cancer was hormone driven. I think that is pretty much up to date. That is the whole story of my journey.
The first thing that comes to mind is years ago when you had that, hey, I think this is cancer. We'll confirm, but I'm pretty sure this is cancer. When you first receive that news, you get a flood of emotion. You get a flood of what's next, what's happening. You try to get a timeline of how you're going to get through this. Did you ever think it would be a 2-year process?
No, I definitely didn't. First, the initial shock is just overwhelming and unbelievable. And you just, how am I here? Is this really happening? It was almost like you couldn't even process it for a while. But then when we started meeting with doctors and talking more and getting the full picture, I remember at some point somebody was talking about somebody that they knew and how it was 6 months of time. And I was like, 6 months? Oh my gosh, that's so long. I can't believe it. And then somebody else said it was a year and a half total. And I was like, oh, that's crazy. That poor girl. And then I never would have thought, I mean, my active treatment where it was the day to day, it was consuming, was about a year. And then from there, I had time off between like reconstruction surgeries and everything. But I certainly never thought it would be 2 years before it was kind of at the point of being the new normal.
And odds are it's not over. They always want you to come in for follow-ups and rechecks.
Yeah. I have to go once a month for a shot. I have follow-up appointments. I have my yearly mammogram. And it's not just a follow-up appointment with one doctor. It's follow-up appointments with, for me, 3 different doctors, radiation, oncology, and my breast surgeon. So I see each of them once a year or twice a year as of now. It adds up.
Especially in time. And on top of that, you're staying at home with your children, which means that every time you have to go to the doctor, you have someone help to watch your children while you go to the doctor, take them with you, or...
No, I can't take them with me. They're not even allowed. Going through everything, my mom would come up and stay with me a lot when I was going through all my active treatment, all my surgeries, my chemos. She was here a ton. But now that it's just once a month and my kids are in school, I can schedule appointments while they're in school. So that makes it easier. And in the summer, my husband was able to take off of work or work from home on different days if I needed to go somewhere. So we were able to make that work pretty seamlessly.
I have the highest respect for the professionals who helped you get through this journey. I know that it was a challenging one, an unexpected one, maybe even an uncertain one, but I'm glad that you're coming out on the other side. So you're in official remission?
Yes, as of September 14th, 2021, I was considered cancer-free. That was the date of my mastectomy when all the cancer was removed.
Mm-hmm.
Since then, there haven't been any signs of anything else.
I am very thankful, and I'm glad that that's working out okay.
Yes.
I know that it's been a challenging journey. As you were going through it, and as you still are going through it, did you have any positive memories?
Yes. A lot of it feels so dark and so hard and so many tough times, but you manage to find joy in the midst of it. I'm still a mom. I'm still a wife, and we had family vacations in the middle of it. We had people that came to visit. We had days at the park. A huge source of joy was just the community that came around me in that time. My faith is very important to me. So my church came alongside me, people who didn't even know me who would bring meals to me and my family. My good friend and next door neighbor would go on walks with me. Another friend that I would just meet with and vent with and just share feelings. And so just seeing people support you and show you love. I felt very loved during that time by a lot of people. I had a lot of people who were praying for me and would reach out to me and just share that. People who didn't even really know me, but had just heard of my situation through my parents or through the church. So that definitely brought joy in different ways. And people really show up. It's just cool to see the number of people who didn't really even know me, who would reach out to me and send me care packages and cards of encouragement and letters of prayer. That really means a lot because you don't even really know them. It makes me think now, I try to look for those opportunities of people who I can support in those ways, even if we don't really know them, or can we support them financially, just to be more aware of that, having been on the receiving end.
And wanting to be that one to bring the joy to someone who might need it.
Right, exactly.
When you went through the journey, what were some of the challenges that you faced?
The emotional toll of being a mom and going through it, we tried to keep up a semblance of normalcy for the kids while they knew mommy was sick and mommy had to go in for all these things. And I still had to be their mom. I couldn't just always lay in bed or lay around. I did that a lot. Don't get me wrong. When I was going through chemo and when I was recovering from surgery, I did do that a lot. There were other times where I just emotionally couldn't do it. And so I would be in bed and my husband would have to step up, or my mom. But other times I got them on the bus. I got them to school. I picked them up. I made dinner a lot. Sometimes what was hard was just having to continue to do normal life when you didn't really want to. And maybe I just wanted to lay on the couch and watch TV. And then physically, I mean, I think I can't remember, we counted 6 or 7 surgeries over the course of that time. From a physical standpoint, I had like a biopsy where I had to go into the hospital when they did my adrenal gland. I had to have my right adrenal gland out. I had to have a mastectomy and then a follow-up. I had to have 2 reconstructions. So that's 6. 3 of them were unexpected because 2 had to do with the adrenal gland and then 1 was the follow-up to my mastectomy that wasn't expected. Physically, that was challenging to be in and out of the hospital a lot. The chemo in the beginning, I did really well with. And then when I hit that second one, it was hard. I remember thinking, oh, if I was just tired, I'm in bed, or I am sick. But there was just some weird side effects that hit me differently that made it hard to even lay in bed. I would have these feelings of like jitters where I couldn't lay still. And so I was so tired, had no energy, and then laying in bed was uncomfortable. And so I would try to get up, but I would feel terrible. And then you're like, how am I going to get through the day? How am I just going to get the hours to pass? After each chemo, I would have 3, 4, 5, 6 days of feeling that way. It would get harder every one. So sometimes it was just looking at the day and thinking, how am I going to get through this day? So that was a really hard time.
Did you ever face social challenges?
The biggest challenge we faced was that it was during COVID.
Oh, no.
So February 2021, COVID wasn't even around for a year at that point. So we were still people in face masks. And if I got COVID as being a cancer patient, it could be really bad. What did that look like for me in terms of going out and about, being around other people? What was safe? What wasn't? How do we navigate that? Wearing masks to our appointments, which is fine. But then there was also limitations in terms of who could come with me. A lot of times people can have somebody with them during chemo, whereas I couldn't. I had to be alone, which at least for the first several times, I think would have been nice to have somebody with me, but they weren't allowed to be. For us, we were so thankful when the vaccine came out because my parents were able to get it, and then we could feel comfortable with them coming to take care of me without worrying that they were going to bring us COVID. I think that as far as insurance companies, honestly, my husband handled all the financial side of things. He paid the bills, he worked with the insurance companies. That was just something that I couldn't do on top of everything. And so he took care of all of that. And I don't think that he particularly had any huge challenges. We had a little bit right in the beginning when we were trying to get started with chemo, where the insurance company wasn't coming through fast enough in terms of approving the chemo. And so we weren't able to get started as quickly as we wanted to, which when you found out you have cancer, all you want to do is say like,
let's go now.
Yeah, the faster the better. How is it spreading? Is it getting worse as we wait and we're ready to go and we're waiting for the insurance company to come back and approve my chemo? And they were trying, they just were waiting for that approval to come back. And there was only so much that they could do. But at that point, do we try to go switch to another hospital, which was overwhelming to think about? I remember that was stressful. I would say that was the one big thing. After that, I wouldn't say they were like always smooth, but they went. There was nothing else big that I can think about like that.
I didn't even think about, cancer during COVID. I would imagine that takes a lot of strength. We were already all isolated in our homes during COVID. And then not only are you isolated, but now you can't get the help that you might need from your community to go through a challenging cancer diagnosis.
Yeah, there were things like we couldn't go to church, which we really wanted to do. Well, our church wasn't even meeting at the time because of COVID for a while. And then when it started meeting, we just couldn't take the risk that I would catch something. And then I think there were some things with the kids' schools that turned out all okay. But, you just constantly had to be asking yourself, is this smart for us to go here? Is this a risk that we're willing to take? Are we just going to stay at home all the time? And we didn't stay at home all the time. Thankfully, we were able to do a lot of things outdoors, and everybody was good about wearing masks around us or just taking precautions. It was an added layer that you would not expect to have to deal with. And I remember saying after COVID, that was the worst year. And then 2021 was like, just kidding. Let me one up 2020.
Well, 2023 is looking better. We're
2023 is looking a lot better.
You've been through a heck of a diagnosis, and you had some positive memories and you had some joy across your society. And then you also faced some challenges. How do you think that we as a society can improve our breast cancer care for our patients?
There's always more awareness of it. At age 33, I was not doing any sort of checks. That you're not at the point where you're doing a yearly mammogram yet, nor did I think about that, nor did my doctors talk to me much about anything along those lines. And I do think I'm hearing more stories of people who are younger who are getting breast cancer. There needs to be more talking about it when you're younger. I think it's generally, you think of it as something that people who are older get. And while that's probably still mostly the case, if I had been doing more checks, if I had been just thinking about it more aware, I think I could have found it a lot sooner. I may have not had to do radiation. There are different levels that you have to do based on how bad it is. And mine was pretty large. So I had to do chemo, radiation, mastectomy. I didn't have the option to do just like a lumpectomy. I had to do the whole tissue for my surgery. Maybe educating younger women would be helpful, that it can happen to you and here's what you can do.
How young can you go?
And you don't want to scare kids, but I think at a certain, when you become an adult, when you're 18, when you're moving out on your own, maybe it's something that colleges can do or encourage. When you see your general doctor at a certain age, they could start encouraging you, or even things that are really easy. They say, do your monthly checks. Okay, well, I wasn't doing those, but if the doctor had encouraged me, like in the moment, put a reminder on your phone that would come up once a month and say, do your check, or here's this app that we recommend you download that reminds you to do it. That could be helpful, because there's no reason why women can't be doing that from a young age and familiarizing themselves with what's normal and what might not be normal. It doesn't have to be going at age 20 to get a yearly mammogram. Self-checks can catch a lot. And I know if I had been doing that, I would have caught mine earlier.
If I were to hand you the microphone right now and I just said, what would you like to tell the entire industry about breast cancer awareness and how we might make things better, what would you tell them?
Just support others the best that you can. Be compassionate. Look out for ways you can help each other. You can encourage each other. People that you know that might have breast cancer that you can send a meal to, a gift card to DoorDash to. That was something that people would send us that was just so helpful when you didn't feel like cooking. The more that we can just support each other and support those people who are going through it, it's huge to feel like people are coming alongside you when you're going through that, and that you have people around you who love you and care for you. The little things make a difference. The notes, the meals, the walks that you can take with somebody, the times that you can spend with them. Be on the lookout for ways that you can support others.
Dave just posted something on LinkedIn about that. He identified someone who might be they're going through the journey, and he was encouraging other people to help to support that individual.
We think that, oh, well, I don't know them that well. Would it be weird if I reached out to them? It wouldn't be weird. It's not going to be awkward. They're going to appreciate it. The other thing I think that people do is you offer something. It's really easy for somebody to turn you down when you give them a choice because they feel weird, or maybe they are like, no, it's okay. Just send a gift card. Whatever it might be, send a note. They're going to appreciate it. If you ask, sometimes people have a hard time accepting help. Obviously, I don't want to force yourself on anybody, but I find myself saying, I'd love to bring you a meal. Which night works for you? As opposed to, can I bring you a meal? Is there anything I can do? Those are harder to answer. If you say, what night is good for you? Then kind of opens the door a little bit. So sometimes the way that you do it can really be helpful too.
Well, I have to say, Courtney, your story is a true inspiration. I really appreciate you coming on to CRPN Central today. And I look forward to sharing this with the audience. I think it's a true inspiration, especially for Breast Cancer Awareness Month.
Thank you. Thanks for having me.
I'll talk to you later.
All right. Thanks.
Bye.
Bye.
Our next guest is a passionate professional dedicated to improving cancer care for our community. Tushar Pandey has extensive knowledge in healthcare data, physician engagement, cancer care, and he is currently the Chief Executive Officer of Symbiosis, an organization dedicated to enhancing the future of precision cancer care. Tushar has an amazing passion and knowledge for the topic, and I'm thankful he has taken the time to speak with us today. Please welcome with me Mr. Tushar Pandey. Thank you so much for coming on to CRPN Central today.
Oh, it's my absolute honor, Dr. Fox. Thank you for putting these together.
Would you be willing to give the audience a brief introduction?
Absolutely. Hey, everybody. My name is Tushar Pandey. I'm the CEO of an early-stage startup called Symbiosis, based out of Chicago. Symbiosis' mission is to redefine precision medicine by providing patients and physicians with tools to individualize treatment planning, specifically in cancer care. My background has nothing to do with cancer directly. I'm an electrical engineer by education. I fell in love with healthcare generally. In my early career, I thought I was solving the biggest socioeconomic problem of our lifetime, which is the cost of healthcare, by providing physicians and providers with information around what it costs to deliver care, and using behavioral economic concepts like what would happen if I showed a physician $2 signs versus one? Would that change behavior or not? And was living the dream. Got to work with over 300 health systems across the country, deploying a product called StrataJazz that was under a company called Strata Decision Technology. And then you realize when it comes to cancer, costs go out the window. So your family and cancer costs go out the window. And that's the experience and the journey I went through, specifically with my mother, who was diagnosed with cancer in 2018. And I knew enough to be dangerous about the cancer care space. I knew what tests to order. I knew which physicians to go to. What I didn't appreciate is for cancer specifically, the amount of uncertainty that exists in decision making. And that's when we went on a quest to help solve that problem with Symbiosis.
What does Symbiosis have right now that they're working on?
The product where we started with, Dr. Fox, was, and what you had seen in the early days, was the solution, which was similar to Google Maps. You and I use Google Maps by saying, we are here today and we want to go here. We might even know the address and we might know exactly how to get there, but we use it to eliminate any uncertainty. And that's the kind of approach we wanted to create in treatment planning, specifically in therapy selection in cancer care. So can we help providers understand what would happen if they gave treatment X versus treatment Y, and understand the roadblocks that may exist and understand the outcome all early in the process in order to inform their decision making, but also to support the shared decision making for patients. As we evolved as a company, one of the things we realized, and that's why you heard the vision redefine precision medicine, was the selection of the therapy is only one component of precision medicine. If you think about the end-to-end journey for a patient, it's all the way from how did they get diagnosed precisely? In early stage cancers, what's the appropriate surgery? Then it is, when do you give treatment? Do you give it before or after surgery? They're called neoadjuvant versus adjuvant. To what is the risk of this particular patient in terms of having a recurrence? To what is the dosing that should be given?
Wow.
To what is the right information that should be given. That's the real precision medicine journey that patients go through. And the product that we're putting together is essentially an end-to-end multidisciplinary platform that supports that entire continuum that the patients go through, and the uncertainty that multidisciplinary physicians, radiologists, surgeons, medical oncologists, pathologists have to go through as part of planning that patient's care and executing that patient's care.
October is Breast Cancer Awareness Month, and we are putting together this very special podcast specifically on breast cancer awareness. I have exploratory questions specific to breast cancer awareness. I'm going to ask you these questions, and then I'm going to ask another interviewer those same exact questions. We're going to compare what you say versus what the other interviewer says. We're going to see if there's any similarities, anything that we as an industry would like to raise in awareness for breast cancer and breast cancer therapies, treatments, and preventions.
Sounds like a plan. Just to acknowledge Breast Cancer Awareness Month, it is the month that we as a company celebrate throughout the year. Our first product is focused on breast cancer, and over the last 4 years of this company, the journey has been to learn both from physicians, multiple types within focused on breast cancer, patients, patient advocates, survivors. So we've come to become fans of the entire ecosystem around breast cancer. So this is honestly our favorite month as a company.
Every Friday, I sport my pink. Do you have or have you been influenced by the breast cancer diagnosis from a loved one?
I have come to know many, many friends and family who've gone through the diagnosis. In fact, a lot of patients that we've interacted with have become family to the company because they've shared such a personal journey with us. I'm quite familiar and exposed to the diagnosis and the journey that patients have to go through.
From your experience, could you describe to me the journey through breast cancer from start to finish?
It's not very different than other solid tumors. Breast cancer, just given the prevalence, unfortunately, more women are exposed. 1 in 5 women, I believe, is the statistics, will at some point go through breast cancer in their lifetime. But what's unique about breast cancer is the amount of focus and tools that are being created for patients and for providers, all the way from screening. If you kind of think about a patient's journey, most women have to be screened. There are protocols for their screening. Now, there's variability. What age do you start screening? What does risk really mean? Is a risk a genetic risk? Is a risk indicated by what you've had in your family? There's still a lot of gray there, but the first part of their journey starts with screening, an appropriate method of screening, which is usually imaging based. A mammogram is very common. Those methods have challenges. A mammogram is a 2D X-ray image that doesn't really fully represent what's going on in the breast. You're going to hear something about dense breasts, which mammograms don't usually work for. The first choice from a screening perspective based on who you are is the image. Now, once the image indicates something abnormal, there is usually a biopsy that follows. In that case, there is a lot of uncertainty, right? A patient's informed there's something abnormal in the image, and the biopsy may or may not be positive. Now, biopsy is not an easy procedure, right? It hurts. Patients have to get scheduled and they have to deal with the uncertainty. What the biopsy does is confirms whether there is disease as suggested by the image or not. And then they go to a particular physician. And usually if you have early stage breast cancer, you start with a surgeon as your quarterback, because the first curative treatment of breast cancer is surgery. And there is a decision point there. What's the right surgery? Is it a mastectomy, which is a complete removal of the breast? Is it breast conservation, or lumpectomy, which is a partial removal of the breast? Women also make the decision, even women that have a negative biopsy but have some risk in the family, choose to get mastectomies as a preventative measure. So there's lots of decisions that go into it. Once the surgeon has seen you in that space, the surgeon generally recommends that decision. When should you have the therapy? And could we give you therapy to shrink this tumor further? Which is called neoadjuvant therapy. And that's when you're suggested to go to the medical oncologist, where the medical oncologist decides what the therapy is and how aggressive the therapy should be for you. And usually that decision is made based on population statistics. And there is a little bit of uncertainty how well you might do from these therapies and what the side effects may be, what the adverse effects may be from this therapy. And then you wait, you go through this journey, and then you unfortunately have to deal with a certain amount of uncertainty that goes, will my cancer ever come back? Luckily for a lot of patients, there are tests coming out that indicate and personalize that type of risk for patients. It is an uncertain journey for a lot of patients.
It's amazing to me how many professionals all come together to help a single person to navigate this diagnosis.
Oh, they're all heroes. And when we think cancer, we think oncologist. It is much more multidisciplinary than that. All the way from your radiologist, your pathologist, your surgeon, your oncologist, your nurse navigators, your nurses, your techs. It is a huge team and a huge effort. And don't forget the importance of patient advocacy and patient advocates who provide the support to these patients to be able to go through this journey.
An entire community. Throughout your journeys and through everyone that you've talked to, do you know of anyone who has not survived breast cancer?
There are many, unfortunately. Breast cancer is one of the leading causes of death amongst women. While the survival rates are good relative to other cancers in breast cancer, just given the sheer volume of patients that are impacted. The deaths from a volume perspective are quite high. If you kind of think about breast cancer, it isn't one disease. It is a variety of disease lumped into this cancer category because of the part of the body it's in. And based on the type or the subtype, both molecular as well as from a size or morphology perspective, that really impacts their ability to be able to survive this.
Do you find that a lot of the preventative measures that we are putting in place for breast cancer is helping to catch these?
Screening is an evolving area, not just in breast, but across solid tumors. You're hearing a lot of blood-based screening. You're hearing a lot about imaging-based screenings that are continuing to evolve. The example I gave earlier around insurance is approving MRI as a screening modality for dense breasts. That's going to help in a significant way because you can catch tumors that may not be visible in a traditional mammogram that's been the general modality of screening much, much better. Now, it is controversial how much of an impact screening has in breast cancer survival. The stage which is caught, if you're going to think about breast cancer, stage 1, stage 2, stage 3 versus stage 4, which is metastatic disease, that means it's spread further than just the breast into other organs. You kind of view them as differently. Survival for stage 4 patients, unfortunately, is still horrible and really disheartening. While there's been progress with better drugs and patients have extension of lives, there really hasn't been a solution there. On the flip side, in stage 1, stage 2, stage 3, it is still uncertain how much of an impact early screening has. It does have some, but it hasn't been clear if you catch it in stage 2 versus stage 3, is that really helping your survival or not for these patients? There's some wonderful studies happening to better inform and personalize screening. Tools and mechanisms and studies are being done to be able to improve the impact screening has and to be able to personalize that for patients.
It sounds like you have met and known and experienced and even lived through the cancer diagnosis with so many people. Can you tell me some of the positive memories that you have seen or experienced or witnessed?
Yeah, absolutely. I have interacted with numerous women who have gone through the journey end to end. And what you see is this emotional transformation that women have as they go through the journey. If you kind of think about hearing for the first time the words, "you have cancer," that is the most disheartening thing you can do. And unfortunately, a lot of women have to hear that still to this date. But then as you move through the journey, like we were talking about, there is this immense uncertainty that happens. What is the right treatment for you and how effective is the treatment going to be? I have met with numerous women who started with that side, played a role in their own treatment decision-making because they have to. It is a very collaborative decision. The doctor that you work with, the team that you work with doesn't make that decision in a silo. It is an incredibly collaborative decision. And in that collaborative decision making, women become incredibly empowered to be part of their treatment plan. And that's where you see miracles and success stories happen, where informed patients are part of that process, working with their physician to say, this is what we're going to do, this is what I'm going to comply to, and this is the journey I'm going to take, and take that journey and come out with incredible, incredible outcomes.
It's almost like since they are their own self-advocates, they are the most passionate about the results.
That's right. I can give you an example without sharing the name. Recently of a lady that went through quite an uncertain journey in her treatment plan. Started with a diagnostic test that said, hey, you don't need any chemotherapy, and that's what was done. Unfortunately, diagnostic tests are not perfect. They're indicative of what's likely to happen. This woman had pretty significant recurrence of this disease, went through another journey, and this time understood what the journey would look like, felt more empowered, took this journey again, and came out on the other side with a complete remission of her disease. That's not even the best part of the story. She wanted to take her own lesson and her journey and help others who may be in similar journeys with her. And that's why you see the power of patient advocacy in this space is incredible. The support that patient advocates provide to themselves are incredible. And each one of these patients have a very unique journey, but there's somebody out there that is going through a journey like them or will go through a journey like them. And the willingness for them to be able to share their information with others and be the shoulder or the guide for others is an amazing, amazing transition from, I can't believe I just heard the words, I have cancer, I can't believe I have to go on this journey, to now that I've gone through this journey, I want to help others like myself.
And that must take a lot of strength. I would imagine that for some, it would be hard to relive those painful memories by trying to go through it again, even if it's like a mentor or an advocate for another.
It has to be tough, but these women are superheroes.
Can you tell me about some of the challenges that you've heard some of these women face as they go through their journey?
The biggest challenge is uncertainty in decision making. The first product that we'll bring to market is a product called Tumor Site Land. The focus of that product is to aid in one of the first decisions these patients have to make, is what is the type of surgery that you need to do. If you kind of think about that surgical decision making around a mastectomy or breast breast conservation has a significant impact on the physical outcome for women.
Yeah.
Mastectomy, you lose your breast completely. With a breast conservation, you can preserve your breast. What studies have shown is that long-term outcomes of these are quite similar. More and more women, as therapies become more effective, are able to have breast conservation. But guess what? Breast conservation rates aren't rising at the same rate as the impact of the treatment. And the reason is a lot of these decisions are being made out of fear and uncertainty. This decision made out of fear is get this out of my body, remove my breast so this never comes back. And it's a decision made out of emotion. And that is kind of what we're looking to solve with Tumor Site Plan, is by giving physicians and surgeons a tool that they can share with their patients and kind of make them visually part of the shared decision making. And by showing them, here's the small amount of tumor or the breast that we'll remove, patients are more willing to engage in the conversation of, I think I should have breast conservation, rather than being told what they should be doing. There's some wonderful surveys and literature and analysis that was done that goes into what drives some of that decision making. And it was not knowing what was inside or not seeing that was inside. Unless you can see your cancer clearly, you cannot be more precise about what you should do or more empowered about what you should do. And that's kind of one of the things we're looking to solve for.
Almost like fear of the unknown errs on the side of caution, and that may not be necessary. You could have a little more granularity and make a more of an informed decision.
You're absolutely spot on.
What about financial? A lot of people talk about insurance companies. Do you find that breast cancer patients have to fight insurance companies for their care, or is it pretty covered?
All cancer patients have to suffer from, unfortunately, clinical toxicity. These are drugs that really impact them and that impact their wellness. A significant amount of toxicity comes from financial toxicity as well. Not everybody has great insurance plans, and the financial toxicity with this disease, not just for breast patients, but others as well, is quite significant. If you think about the cost of care, especially in oncology has probably the largest association with cost of care and one of the largest associations with bankruptcy caused by patients' disease. Everybody's impacted by it. Insurance are getting more and more in tune with the needs of patients. There are opportunities also arising from this growing movement around right sizing of care. Does every patient need all the therapies? Or can we be more selective on who needs the most toxic, most expensive therapies? Like immunotherapy, for example, has very, very significant difference in the traditional chemotherapy. Immunotherapy doesn't benefit every patient. And physicians are starting this movement where they're starting to be more selective. Can we know who will benefit before we expose them to that type of toxicity, or both financial and clinical? There is a better world out there and a better future out there for patients for both clinical and financial toxicity. But to your question, Dr. Fox, it is really depressing the amount of impact financial toxicity have on these patients, not just from what they have to pay, but the impact that it has on their work. Some patients not able to work, and there's a toxicity associated with that, and there's no help for those type of patients that can't work because of the cancer diagnosis that they had.
So it almost sounds like we're creating a little bit more of a spectrum, a stratified spectrum of care that maybe it could be a little more financially responsible to help our patients from this financial toxicity.
I will say there's a better future out there for patients. I've heard of numerous stories where drug companies have provided drugs to patients that couldn't afford it on a compassionate basis. I've heard of numerous stories where insurance companies have stepped in and approved drugs that their physician believed will lead to a better outcome for these patients and have reduced the impact on some patients. But those stories are rare. More broadly, what you hear and what is true is the financial suffering caused by the cost of cancer care is very significant. That is a big part of the core mission of Symbiosis as well. By helping right-size care for these patients, you're not just reducing the clinical toxicity, not just improving the outcome, but significantly helping with the financial toxicity.
How do you think that we as a society can improve our breast cancer care for our patients in the future?
It's an excellent question. And if you kind of think about the journey is so broad. So there isn't, one thing we can do or one direction change we can make. It has to be everything from the awareness that we create. And while we love Breast Cancer Month, there shouldn't be just 1 month where we create awareness for breast cancer. Patients die from breast cancer every day, unfortunately, and it's disheartening. So the awareness that we create and the amount of focus that we put in this month of October should be throughout the year. Let's put that energy across the year and create an awareness for this disease where patients know and are well informed on what should they be assessing for themselves, what should make them better understand what makes them at risk so they can be more vigilant with this disease. How can we make screening a bigger part of general checkups? And then all the way from when you're diagnosed, how do we support these patients better? All the way from individualized therapy selection, all the way from how do we better make them part of their decision-making and shared decision-making? And how do we level the playing field for patients that's getting care in the middle of nowhere, or a patient that has the ability to go to an MD Anderson and a large academic center? How do you bridge the gap that exists? Because most of the patients are getting care for their cancer in rural settings where the technology is not as great, the experience of the clinicians unfortunately may not be as great, the access to drugs may not be the same. Something has to give to level that playing field for these patients to have a better outcome and a better experience.
Do you think there is a difference in disparities in breast cancer diagnoses across demographics?
There absolutely is, and it is a controversial area. There's multiple literature out there that says people with worse socioeconomic backgrounds have worse outcomes with cancer. There is a racial disparity conversation that is starting to pick up steam. Unfortunately, minority groups or African Americans tend to have worse outcomes in breast cancer than others. That's partly biological. African American communities are less represented in clinical trials and in research than majority Caucasian community, all the way to access of care. Access of care is not the same for everybody.
Yeah.
Compliance to care is not the same for everybody. The financial question that you were asking me before impacts certain communities more than it impacts others. The coverage impacts certain communities more than it impacts others. So in that regard, it's not a level playing field either. But it is becoming a major part of the conversation, I would say, both in terms of research as well as action that needs to be taken to address this.
Especially improving it based off of diversity inclusion. I think that's going to be one of the trajectories that we really need to target as a society so that we can make sure that everyone has access to the cancer care that they need to live happy lives.
Absolutely.
If I were to hand you the microphone right now and I said, what would you like to tell the entire cancer industry about breast cancer and breast cancer awareness, not only during October, but across the whole year, what would you tell them?
There is a significant amount of research and effort that is happening both in the corporate world, in academia, in community to ensure there's a better future out there. If you have been diagnosed or someone that you know has been diagnosed, hang in there. There is definitely a better future out there. Day by day, this disease and the treatment of this disease and the outcomes of this disease continue to get better. The other is take control of your treatment. Ask the questions. Be involved in your treatment plan. Your physicians are there not just to treat you, but to educate you and comfort you. Take advantage of that system that exists around your clinician. Ask questions. Know your disease. If you can understand your disease, you can be a more informed part of taking care of your disease alongside your clinical team. And then lastly, the survival rate for breast cancer, stage 1, stage 2, stage 3, is very, very high. Luckily for a lot of women out there. When you hear the words you have cancer, cancer is not one disease. Breast cancer has had tremendous improvement, even from 2010s when new drugs have been improved. The landscape of the therapeutic side is changing very, very rapidly. Before you know it, chemotherapies that are considered highly toxic and leave lifelong damage to these patients may not even be standard of care. There's a growing movement around antibody drug conjugates that are becoming more and more effective and starting to replace some of these older drugs. Definitely a better future out there. I remain incredibly excited about what's to come and the level of research that's happening within Symbiosis, but more importantly, across the ecosystem and across the community, that as a collective will lead to some amazing transformation in breast cancer care.
And frankly, I can't wait to see what Symbiosis is going to be doing across breast cancer, predictive modeling, planning stages of oncology.
I appreciate it, and thank you for the opportunity, Dr. Fox.
Thanks so much for coming on to CRPN Central. I look forward to sharing this with the audience.
Likewise. Thanks, everybody.
All right. Bye. Courtney, a loving and dedicated stay-at-home mother, received a breast cancer diagnosis that resulted in a 2-year-long journey of uncertain and sometimes unexpected surgeries, chemotherapies, radiation treatments, and emotional and physical challenges that, at times, made her wonder how she could even get through the day. Nothing was easy, and some of the most challenging moments occurred when she did not know outcomes, prognoses, or certainties. And, as challenging and as hard as it was, she found joy and love in a supportive community, some of whom she didn't even know, bring meals, take walks, and just help her to get through the journey. As a result, she is motivated to help others who currently go through the journey, just like those who helped her. Younger generations of women are receiving these diagnoses at higher rates, and to improve breast cancer care for our community, we must raise awareness and provide education to women and their healthcare providers to perform routine checks and know what may and may not be normal. The little things make a difference. It's not strange or creepy to give if you don't know someone, and just give without permission. However, be sure not to push yourself or your gifts on others. Tushar and Symbiosis are actively working to eliminate the uncertainty of cancer diagnosis decision points, prognoses, and treatment planning by developing advanced tools such as Tumor Site Plan for informed physicians and patients. Tushar has interacted, engaged with, and witnessed the cancer diagnosis journey with many that he has worked with, some who have survived, and others who unfortunately have not. Cancer care teams and patient advocates are heroes, and treatment requires a huge effort. And we see many times an emotional transformation as women who face uncertain and life-changing diagnoses are then empowered to be mentors and patient advocates for future generations. Informed patients take control of their care and make magic happen. And if we can eliminate the uncertainty of decision-making, we can make more informed decisions, take control of our treatments, and avoid making decisions out of fear and emotion. The world of cancer care is improving year by year with right-sizing care initiatives to reduce financial toxicity. And to improve care, we must expand awareness year-round, inform and empower our patients to know their disease, and to continue to progress toward granular and informed treatment planning. Both interviewers confirmed that uncertainty of care and the challenges our breast cancer patients must endure make them by far courageous, diligent, and compassionate. Both interviewers also confirmed awareness, education, and informed decisions are paramount to improving patient care. And while Courtney has experienced joy and love of her community and believes in helping others as they helped her, Tushar believes informing and empowering our patients to take control of their care truly makes therapeutic magic happen at the clinic. So, how can we improve the experiences and outcomes in health and clinical research communities? As life-changing and physically and emotionally draining as a diagnosis can be, both interviewers agreed on improving principles. To improve care in breast cancer, we must focus diligently on education, advocacy, and informed decisions. Talk about breast cancer and inform women about screening and checks. Advocate for and support patients who are going through their journey as a community, and make sure our patients and their physicians have all of the information that they need for the best treatment options. And know that as far as we've come, we still have a long way to go for a better and healthier future in cancer care. Thank you for listening to our very special dedication to Breast Cancer Awareness Month. Remember, breast cancer impacts millions of women, and the more proactive we can become to identify and treat cancer early, the more lives we can save overall. Stay informed, perform your routine checks, and never wait to seek help if you need it. Thank you to Courtney and Tushar for sharing their experiences today. Thank you to our community voice volunteers, Stout, Viljena Trask, and Samantha Register for building today's CRP in short. Thank you to my brilliant wife, Bree, for recommending this episode topic. And finally, thank you to my CRP and Central sponsors for helping to make this episode possible. Thank you again for listening, and we'll see you next time on CRP and Central.